AMD affects an astonishing 1 in 8 people aged 60 or older in the developed world. The disease's later stage is well known to cause significant vision loss and is the most frequent target for treatments. But is it time to change that? Espansione's iLight low-level light therapy photobiomodulation offers a new way to treat dry AMD early. And in this video, Professor Giuseppe Giannaccare explores the potential of this technology to reshape the AMD management journey.
Dry AMD is the most common type of AMD, accounting for about 90% of cases. Modern treatments for AMD are mainly focused on late stage of the diseases. So there are some drugs under investigation that can slow the progression of geographic atrophy, that is the late stage of the disease. But at that time, patient visual acuity is very poor and cannot be reversed. So we should treat patients in the initial phase of the disease in order to stop the progression of the disease. All treatments that can stop or even reduce the growth and the progression of the disease are desirable in clinical practice. Photobiomodulation, also termed low-level light therapy, is a new technology. It is based on different and specific wavelengths of light up to near-infrared light. This light is emitted by a laser diode or LED, and it targets the cells and causes photoactivations of the cells. So there are a cascade of events at a cellular level that are able to stimulate the production of ATP and CMP. All these factors led to a sustained and improved cell growth and maintenance of cell vital aspects. This technology has been employed at first in a dry eye setting. So it has been demonstrated that it can provide immediate relief to patient discomfort. So it is characterized by a high level of safety and tolerability. So the treatment is non-invasive and does not need the constant presence of the operator while patient is receiving treatment. So the ideal candidate for receiving low-level light therapy are patients with early and intermediate dry AMD. That it means stage 2 and 3 of hard stage classification. So these are ideal candidates in which there are drusen, that are these phenotypes of initial damage of the retina, but not yet the atrophy of the retina that cannot be reversed. In particular, if there is also a family history of the disease, this is another risk factor for a progression of the disease. So patients with a positive family history are ideal candidates for this treatment. Low-level light therapy has different protocols according to the disease to be treated. In dry AMD, the protocol consists of 2 phases. In phase 1, yellow light is used in a continuous and pulsed way with eye closed and then opened for a total of 6 minutes. In phase 2, we employ the red light in a continuous and pulsed mode with eyes closed and opened for a total of other 6 minutes. So the entire mask session lasts 12 minutes. Usually we do 2 mask sessions per week for 4 weeks, for a total of 8 sessions in total. This is the first cycle of treatment. After 4 to 6 months, usually a cycle of maintenance is repeated. This cycle consists of phase 1 and phase 2, but in these cases, a total amount of 6 sessions are performed in 3 weeks. A current limitation of the technology is the high amount of visits needed for for the patient, the portable devices already available for the treatment of dry eye with low-level light therapy can be developed also for dry AMD treatment, so patient can receive at home the same treatment and maybe come to the hospital just at the end of the cycle to receive OCT and to receive imaging for follow-up. We are conducting a randomized, double-blind, controlled clinical trial, including patients with dry AMD treating with low-level light therapy or sham. We analyzed the preliminary results after 6 months of treatment, and we were able to highlight that the treatment was able to improve visual acuity in treated patient and decrease the volume of drusen. Another important finding was the significant lower incidence of conversion from dry AMD to wet AMD that we found in the treatment group compared to the sham group, and we know that conversion to wet AMD is a complication of AMD, and it needs injection with anti-VEGF agents, so this changed the history of the disease. The final results are expected in spring 2025 after 1 year follow-up, and this final result will clarify all the aspects about efficacy and also safety of the procedure. Although our preliminary results are very positive, and we are confident that these results can be confirmed in the long-term study. Dry AMD is not the only indication that concerns the retina with low-level light therapy. We just published a unique case report of a case of a giant central serous chorioretinopathy that was fully completely and successfully managed with low-level light therapy. This was a case resistant to therapy for 10 months that was successfully managed with 8 sessions of low-level light therapy. Currently, we are creating an expert board to study this new aspect with low-level light therapy, and a new randomized clinical trial will start soon with the new indication of central serous chorioretinopathy.
It's time to start thinking about dry AMD earlier than ever, and photobiomodulation with iLight is here to guide the way to a new era in disease management. For more information on iLight and how it fits into your practice, head over to the Topcons or Espansione website.